Speaker.
Lewis Wall.
Kia ora, Mr Speaker.
Kia ora.
Actually, I'm really pleased to follow my colleague Stu Nash because he and I are 100% on the same page in regard to this Customs and Excise Tobacco Products Budget Measures Amendment Bill and the implications, and particularly for young New Zealanders. I have a submission to the budget policy statement that was presented by Warren Lindbergh, who's the Chief Executive Officer of the PHA. And with regard the tobacco excise and what the tax take should be spent on, I just want to outline the initiatives that they thought should be prioritised, given our focus on making New Zealand smoke-free by 2025. And they are targeted health promotion and cessation services for young people, targeted health promotion and cessation services for Māori, particularly young Māori women, targeted health promotion and cessation services for pregnant women and their families whānau, funding post-birth cessation service support for up to 2 years following so that mothers and those around them can sustain cessation. This would provide the maximum health gains for the parents and for all New Zealand babies, and research into effective cessation and effective tobacco policy for New Zealand, including targeted surveys of tobacco use among vulnerable communities and populations. Now, one of the references in that submission was to the ASH 2014 Year 10 Snapshot Study. And the overall, philosophy or principal position that this particular survey articulates in their results is that quitting is hard and protecting children from the addiction of smoking in the first place is best. So I think that makes sense to all of us. But as I outlined earlier, within the context of 66% of our young people trying smoking, and of those 50% of them then smoking for 40 years, and dying from premature deaths, and we've talked about some of the consequences, I absolutely agree with Stuart Nash that we should be doing everything we can to stop our kids smoking in the first place. Now, one of the biggest challenges we have with that, and this is when it gets really interesting, children who grow up in a family where one parent smokes, actually they're 25%. The research is really interesting because it says if you're a young person and you grow up in a family and say both of your parents smoke, if one of them gives up smoking, there's a 25% reduction in the likelihood of you smoking. If both parents give up, there's a 39% reduction in the likelihood of you smoking. So basically, if you grow up in a family where people smoke, or if you see it, then actually the statistics are against your ability to be resilient enough not to smoke. And so that's where it's kind of chicken and egg. We want to focus on the kids, but actually to focus on the kids and preventing them smoking in the first place, we have to help their parents. And we have to stop the parents from smoking in the first place. And what we know is that on average, it takes 7 attempts for someone who smokes to give up. It's an incredibly hard thing to do because of the addiction. And actually, I know this because I grew up in a household where my father smoked 2 packets of cigarettes every day. Winfield Red. Chain smoked. And that's had a devastating consequence on my family. He died when he was 63. He had a heart attack. He had cardiovascular disease, which is one of the outcomes of smoking for that period for over 30 years. I think he was lucky he didn't quite make... Oh, he would have been. He was 63, started in his 20s, so he's the 40-year smoker. But the other thing that I find really interesting, Mr Speaker, is that who supplies young people? And actually the people who supply young people are their parents. So 40% of young people who smoke are supplied by their parents and the immediate family. Another 40% comes from their peer group and those who are engaged in a peer group with older people who can go into the dairies and buy those cigarettes themselves, but actually 18% of them get away with buying it themselves. So we have actually a problem with the enforcement of the legislation that says if you're under 18, we can't sell to you, and if someone does, now they will be fined $5,000. So actually that's good, because there should be more now of an incentive on anyone who sells cigarettes to be super vigilant to make sure that young people do not have access to tobacco. I wanted to I did a little bit of maths, and this is for Minister Lotulinga, because we know that he will be successful almost in reaching the under 5% target for Māori women based on the statistics that I have managed to find in this ASH 2014 Year 10 snapshot survey. Because what it said, Mr Speaker, is that for 14 and 15-year-old Māori girls who are 3 times more likely to smoke daily, that the statistics between 2013 and 14 saw a 30% reduction in the daily smoking rate and a 7.6% reduction in the regular smoking rate. And so if I actually apply the 4 years of this piece of legislation, at the end of 2020, I think when we will realise the fruition of this legislation, the daily smoking rate for Māori girls aged between 14 and 15 will go from 8.8% to 5.05%. So we'll nearly get there. But the regular rate for that age cohort will go from 16.76% to 12.22%. And I think therein lies some of the suggestions from the researchers that 10% is a good step, but it's too passive. It should be 20% if we want to accelerate the reduction. But I think after this legislation has been fully realised, there will be an ability for the House to then renegotiate whether that should continue and at what rate, because we will then be seriously getting down to the hard-to-reach communities where actually the ability for our health system to engage with those people, and I want to pick up on what colleague Fletcher Tabato said, he's right. You know, the people who are most affected are the most impoverished. They're the ones who come from communities where the access to public health services isn't as it should be. So how do we get to those families? How do we help those people? How do we ensure that they can be smoke-free? And I think that will be the challenge as we look at how effective this piece of legislation in the future is. It's only one part of the solution. And I think if we were genuinely wanting New Zealand to be smoke-free, actually we would care about the people who are most affected by cigarettes and actually ensure that they had all the services that they need and all the tools that they need and all the support that they need over whatever period of time it takes them to finally realise that smoke-free aspiration to be supported. And for my father, in the end, it was going to a hypnotist. It worked for him. It took him a long time and it took him many attempts, but eventually he found a tool that worked and he was able to be smoke-free. But unfortunately it didn't erase the 25 years of his smoking beforehand. And that's what I regret the most. But this, through pieces of legislation like this, actually will start to impact on the mortality rates and how old or how long it's anticipated that some of us will live. And so I commend the bill, this bill to the House, and I again just want to say to the Minister, congratulations, but there's so much more to be done. Thank you.